our annual Public Science Symposium coming up, and it's on the 23rd, which is, I guess, two weeks from today. 2 weeks from today. And every year we try to choose some topic that's been in the news and that I think is of interest. And there's no question that this past year we've heard a lot about Ozempic. And it certainly is worth discussing because it has so many interesting features. The other topic that we're going to deal with are dietary supplements. And I know that there's a lot of interest in that because I know that those are the kind of questions that I always get. So we have invited experts. Dr. Peter Cohn from Harvard is probably the world's leading expert on dietary supplements. And Dr. Patricia Brubaker has done research on the GLP-1 agonist, the Ozempic drug. So you're going to hear this from the mouth of the horse, as it were. It's free, of course, but the only thing we do is we ask that you register online so that we have some idea of how many people are coming. Okay? Of course, when you register online, you're not obligated to anything. It's just for us to know how many people. So anyway, you do that online. All right, the topic that I've chosen for today is the history of medicines. And I'll warn you, this is going to be a blizzard of facts because there's no other way to do that. If we're going to go through drugs from history to now, you have to do it chronologically. But I think even, without you paying too much attention to the details, to the names of the medications, etc., I think what you will get out of this is the story of how we have struggled with disease through the years. Why is it that these drugs had to be introduced at those times? The first thing, of course, we have to understand is what a drug is. It's any substance other than food. I mean, we don't really consider food as drugs, even though it obviously has an effect on our health. Anything other than food that we introduce into our body hoping for a biological effect. That's what drugs are. All right, let's go back in history. And we're going back a long way. We're going back to 11,000 BCE. When, believe it or not, we encounter the first drug that was ever produced. And we have been producing it ever since. That, of course, is alcohol. And we know this because of some stones that were unearthed, as you can see here at the Rakfet Caves, which is basically where Haifa is in Israel. And they found remnants of barley and wheat. And these grindstones, which mean that they were ground into a mash. And they also found some of these grains had sprouted. I'm not sure exactly how they determined that, but they were able to determine that. So there we go, something like 11,000 BCE. Already, people were thinking about getting drunk. 8,000 BCE, another mind-altering substance was already being used, and that is the coca leaf. And today, of course, we know that it contains cocaine, complex chemical formula. Obviously, they had no idea in those days. They just knew that if they chewed the coca leaves, they would feel better. But interestingly enough, they also figured out some interesting chemistry. That if they sprinkled some lime, not lime the fruit, but lime as in calcium oxide, onto those leaves, the active ingredient would be dispensed more easily from the leaf. What is calcium oxide? You get that by heating calcium carbonate, as in seashells. So they heated the seashells, ground them up, mixed them with the coca leaves, and enjoyed themselves. Now, how they ever came to that conclusion, I mean, obviously, that is lost to history. They didn't keep written records about their chemical exploits. But obviously through trial and error, this came to light. Then by about 6000 BC, winemaking was becoming quite popular. And we have examples of that. We have all kinds of artwork that dates back to that time. So there's no question that they were, making wine, essentially by the same process that we do today. And then 5000 BC, tobacco plants were being cultivated in the Andes Mountains in South America. They had, once again, somehow by trial and error, found that this had a beneficial effect. Obviously, they weren't aware of the downside of tobacco in those days. Now, how did they do this? They obviously didn't smoke cigarettes or cigars. What they did was they threw the tobacco leaves into a fire and then inhaled the fumes. They didn't have to worry about eventually getting lung cancer because they died in their 30s, anyway, from all kinds of other diseases. But again, just think that 5,000 years ago, already they were making use of these substances. Then, 3500 BC, the peyote cactus was discovered to have hallucinogenic properties by natives in North America, basically in the area of Texas. Now, once again, this obviously came about by trial and error. Somehow, probably some of the peyote cactus got into a fire. They would burn anything that could burn. And the fumes, they found delightful. And it's not surprising that they did that because mescaline, which is the active ingredient in there, is a hallucinogen. And of course, it is still used today, used and abused. The peyote cactus is one of the most abused substances in North America. And then we come to the introduction of perhaps the most famous drug ever to have hit the pharmacopoeia. And we have been using it ever since. What would that be?
Marijuana.
Opium. This takes us back to roughly 3000 BCE and Sumeria. Well, Sumeria basically is where Iran and Iraq is today. And that relief that you see there dates back to that time. And there's no question that this medicine man, which is what he probably was, is carrying the opium poppy. Now, it wasn't for decorative uses. It wasn't for the nice flowers that the poppy would bloom into. It's because they had discovered that if you take the exudate of the poppy and consume it, it would have delight-giving properties and also take away pain. They didn't know that it contains a whole bunch of compounds. We know that now. But the main compound in there is morphine. So opium is just the crude resin that comes from the opium poppy. You make an incision in it, this juice oozes out, it eventually hardens, and that is opium. And we have been using it in one form or another ever since then. The Chinese made very significant contributions to the development of pharmaceuticals and also the development of medicine. Emperor Shen Nong, sometime around 2700 BC, introduced these three substances, which of course we're still using today. Tea. As the story goes, and there are many legends that are interwoven with the history here, and you never really know whether it's true or not. But the story is that he was heating up some water, and leaves from a tea tree happened to fall into it. He consumed it, he liked it. First time ever anyone consumed tea. And again, we have been consuming it ever since, in many different ways. Now that would have been what we call green tea. Most of the tea that we drink today is fermented tea. That is, the tea leaves are allowed to age in order to develop a flavor. However, the beneficial compounds, which we now know about, are much more found much more in the green leaves. So in terms of health properties, the green tea is better. They were also aware of ephedra, which is a plant. It contains a compound we know as ephedrine, which is very effective in the treatment of asthma. And that long ago, the Chinese knew that if someone was suffering from asthma, of course they didn't know what that disease was, but they had breathing difficulties, if they would throw this plant into the fire and inhale the fumes, they would feel better. And ephedrine eventually did become a legitimate treatment of asthma. And then Shen Nong supposedly also introduced cannabis. Cannabis contains tetrahydrocannabinol as the active ingredient, and of course it is still popular today. So again, 2700 BC, they already knew about these things. Then along came the Egyptians. Now the Egyptians kept very careful records, right? So that when we read this so-called Ebers papyrus, Ebers is the name of the archaeologist who found it, and different papyruses were found named after whoever discovered them. And the hieroglyphics here have been interpreted, so know exactly what this is. And they certainly talk about opium and cannabis, etc. The Egyptians were excellent at keeping records, right? So we rely on them on history. And this is where I told you when we discussed the Passover story, that there is no record in any kind of Egyptian writings of anything that would corroborate the story of the Exodus. The Jews were never slaves in Egypt. That just didn't happen. The Egyptians would have recorded that. But anyway, in medicine, they recorded everything very, very accurately. So they were using cannabis and they were using opium. Of course, they also had a lot of nonsensical remedies, like tying a baby crocodile onto your head to cure a headache. That didn't do any good, either for the person or for the baby crocodile. In 324 BC, one of the most interesting stories, Alexander the Great, who of course ruled a huge empire in the Middle East. And when he conquered India, he organized a drinking contest. Originally, he was going to organize an Olympiad, just like they were organizing it in Greece. But he couldn't find enough people in India who were going to partake in this sport and run naked through the streets, which is the way that the original Olympics were done. The athletes were all naked. So he organized something else. He organized a drinking contest. Well, in India, people weren't used to drinking alcohol. And this was really quite remarkable because everyone who enlisted in this adventure died, including the winner, who just happened to be a Greek, Promachus, and he died of alcohol poisoning, but it took him a few days to die. Not one of the great achievements of Alexander the Great. In 77 AD, so now we're starting to come into the Christian era or Anno Domini AD. And Dioscorides was perhaps the most famous Greek physician at that time. And he cataloged about 600 plants that he thought had medicinal value. He also thought that milk and honey had some medicinal value. And he was right about some of this. For example, the mandrake plant, which is a very interesting plant because, as you can see, its shape is shaped like a human body. And in those days, they believed in what has come to be known as the theory of signatures. If a plant or a part of a plant in any way resembled the human body or shape of the human body, it was supposed to be good for that. It is as if by some sort of divine providence, we were to look at the natural world and know what is going to be good for us. Well, the fact that the mandrake root resembles the human body has nothing to do with its efficacy, but it does contain a number of compounds like atropine and scopolamine, which certainly have physiological activity and would have been useful in putting people to sleep, to do surgery. And yes, they did do surgery in those days. They, for example, tried to take out kidney stones and gallstones, usually not with some great success. But they did manage to put people to sleep, mostly with opium. The Greek physician Galen of Pergamon had a huge following for the next, about 1,500 years, which is hard to believe, that everything that Galen said was just believed because they believed in eminence. If someone was famous, and Galen became the most famous Roman physician, was originally born in Greece, but he became physician to the Roman armies. And he really promoted the idea that health was determined by the flow of humors in the body, which he defined as blood, yellow bile, black bile, and phlegm. And if these fluids in the body were somehow out of control, that's when illness would come. And you could cure this by using outside agent to rebalance these humors. And as you can see, he talked about things like cannabis in order to try to restore health. Galen was very much revered, perhaps even more so than Hippocrates. Actually, Hippocrates originated this idea of the four humors, but it was Galen who popularized this. And he was to be followed, as I said, for about 1,500 years. Now we take a jump to 900 AD and the Mayans of South America, and they were already cultivating the cacao tree because they discovered the delights of chocolate. Now, of course, they didn't make chocolate bars, they didn't make milk chocolate. What they did mostly was to grind up the beans inside the pods of the coca tree, put them in hot water, and drink that. It had an invigorating effect because chocolate does have some mood-elevating substances, and you can see that they were already enjoying this, around the year 900. And the name of the tree actually is Theobroma cacao, which means gift from the gods. And a lot of people today still think that chocolate is a gift from the gods, especially when it comes to dark chocolate, but they're wrong. There's really nothing magical about dark chocolate. I mean, I know you hear of all the stories about the polyphenols in there. By the time that you ate enough chocolate to get your dose of polyphenols, you'd be way overdosing on sugar. 1025 AD, we come to Ibn Sina. That was his actual name in ancient Persian. We call him Avicenna in English. He was sort of the Hippocrates of the Muslim world. His writings were spread far and wide, were very much revered, and as you can see, independently, he talked about opium. So all these ancient doctors knew about opium. He advised it for the treatment of things like gout and muscle pain and nerve injury, and that makes sense. And again, they would carry out some surgeries, for example, try to remove blockages from the urethra. There wasn't much that they could do. I mean, this was before catheters, but they would try to, open up the urethra with various kind of primitive surgical instruments, which was very painful, but they did use opium in order to try to reduce the pain. Now we come to a story which is probably legendary, but it's important because it has been retold so many times. And this was around the 11th century when a Persian warlord by the name of Ibn Sabah Not a nice guy. Basically, he was a professional assassin. Whoever would pay him, he would go out and do the job. But he had lots of men to help him. And the story is that these men were willing to partake of all of these adventures because he promised them a vision of heaven. Well, he did kind of give them a vision of heaven because what he gave them was hashish. Hashish is concentrated cannabis. It is the resin that can be scraped off from the leaves of the cannabis plant, and it is especially high in tetrahydrocannabinol. So yeah, they could have ingested enough of that and gotten a vision of heaven. And as the story goes, our term assassin comes from his name because in English it was translated as Hassan ibn Sabah. Again, that probably is an apocryphal story, but many of those apocryphal stories are pretty good. In the 13th century, the Aztecs, who already had a huge empire in Central America, discovered that chewing or smoking the seeds of the morning glory plant was sort of glorifying. It made them feel extremely good. It was referred to as obloquy, and today we know why. Because this plant contains lysergic acid. And lysergic acid is you know from the name, is the compound that is very similar to lysergic acid diethylamide. And it is a natural occurring compound. Interesting enough, the symbol that you see on the shield, that is the symbol that they used for to symbolize the morning glory, the shape of the morning glory, which they essentially worshipped. So it naturally contains lysergic acid amide, not diethylamide, which is LSD. We'll get to that a little later. But this was a natural hallucinogen. Now, of course, historically, humans were plagued by all kinds of disease, especially by the plague, the so-called bubonic plague or the Black Death. And this was the kind of doctor that you would have seen during those terrible days when Black Death was striking everyone down. And they had these masks with the beak. It wasn't in order to prevent viruses or bacteria from spreading. They didn't know anything about viruses or bacteria in those days. This was filled with aromatic herbs to protect themselves from the smell of death, because death was all around them. There were people dying and rotting in the streets. It was a terrible time. The remedies that they came up with didn't have any scientific basis. They're nonsensical, such as the chicken remedy. The idea was to tie a chicken, a live chicken, with the feathers plucked out, onto the body. And when the chicken stopped struggling, it meant that it had sucked the disease out of the body. If that didn't work, they would use a second chicken, to do this. And eventually, this wasn't good either for the patient or for the chicken. There was another remedy that was tried for the bubonic plague. The bubonic plague was so called because on your body you formed these bubons, these growths, blisters. So that's where they attached the chickens. But they also thought that chopping up a snake and putting it on these blisters would also have a curative effect. And again here, medicine was tied into mysticism, to faith and to belief, because of course the snake in the Garden of Eden was supposed to be symbolizing evil, and they thought that evil is attracted to evil, which it sort of is, right? I mean, you look at Trump and Cruz and Giuliani, this still holds true. So they thought that evil would be drawn out of the body, but of course it wasn't. bubonic plague was a terrible disease that killed half of the population of Europe at that time. Then around 450 AD, we begin to see some pleasant things, originally from Yemen, when again, as the story goes, probably apocryphal, a shepherd noticed that his sheep, goats, had been dining on the berries of this bush, and they began to frolic. So he thought he would try this, and thus the idea of brewing coffee was born. And this originated in Yemen, and of course it quickly spread around the world. And I say, well, quickly, today everyone is on TikTok, etc., so we expect instant, feedback. In those days, quick wasn't that quick. It took 25 years for the world's first coffee shop to be opened in Constantinople after that discovery. And of course, we have been drinking coffee ever since. Now we come to the man who has had a tremendous impact on medicine. And this was Paracelsus. Paracelsus was Swiss-German. And of course, in those days, there were no such things as professional scientists or professional doctors. You kind of learned a trade by following some masters. He was into all kinds of things. He was into alchemy. He was into studying minerals. He was sort of interested in everything. Now, what we remember him for most is his classic statement, which I have told you numerous times, which is that only the dose makes the poison, right? You can't tell anything about a substance in terms of toxicity unless you know how much of it has been taken. Substances can be good or bad depending on the amount that you take. He was the originator of that idea, but he did other things as well. He didn't believe in this business of the four humors. He thought that was crazy. He believed that the human body was actually a machine. He didn't know how it was running, but he thought that disease could be treated by giving the body the right things. So he came up with laudanum, which is a mixture of opium and alcohol, which of course would have had some effect. Anytime you mix opium and alcohol, you're gonna feel better. The crushed pearls wouldn't have done much, neither would the musk and the amber, but these were all valuable substances. So it was believed that if you put something really valuable into the concoction, it would be all that much better. But Paracelsus really changed the scope of medicine, because he said, forget about all of this nonsense of the theory of the humors. The body actually works by some sort of chemical means, and he tried to right the body by giving it the right chemicals. Now, most of the time he was wrong. For example, he introduced mercury treatment for syphilis. Well, it can kill the bacteria that cause syphilis, but it will also kill the patient, right? But he was thinking along totally novel lines. He was thinking about, chemically treating disease. Then at the 1500s, French and English voyagers returned from North America to Europe, and they brought back some gifts, like smoking. They also left some gifts here, like smallpox, right? And numerous other diseases that devastated the natives because they had not been exposed to these things before. So tobacco was introduced, and of course, therein lies a lot of our problems, because tobacco smoking is still with us. Now, Jacques Cartier, on his classic trip to North America, when he stopped in Hochelaga, which is basically what Montreal is today, he was introduced actually to tobacco cultivation, because the natives here already were growing tobacco and they were smoking it. And of course, ever since then, they're into it, and you go through the native areas here and they have cheap cigarettes because they don't have to pay any tax on them. So that goes back to 1535 when Jacques Cartier came here. 1571, Nicolas Monardes, who was a Spanish physician, and he actually wrote a book about the benefits of tobacco along with other plants. And when it was translated in English, you see the title, Joyful Newest Out of the Newfound World. Well, yes, tobacco does have some joyful moments for people who like smoking. But now, of course, we know all of the havoc that it can wreak, which they didn't know anything about at that time. In 1600, Pope Clement VIII finally declared that coffee was okay for Christians to drink. Because prior to this time, anything that was enjoyable was thought to be against the teaching of Christ. Nuns, for example, were told that they had to stay away from chocolate because it was thought to have some aphrodisiac effect. And of course, you want to prevent that in nuns. Drinking of chocolate was also frowned upon, I guess, until Pope Clement VIII tasted the chocolate. And he thought that this was pretty good, and he stopped worrying about it having been imported by the infidels, and that this actually was a Christian drink, and everyone was allowed to drink it. And obviously, we have been drinking it ever since. In the 17th century, the Jesuits, who of course had come to North America to basically convert the natives to Christianity, right? That was the real purpose. But they learned some things from the natives as well. From the natives in Peru, they learned that there was a certain tree, and the ground up bark of that tree could alleviate fever. Now, how the natives ever came to that conclusion, we don't know. Story is that one day someone was suffering a fever and drank from some water into which the tree had fallen, and that chemicals had leached out of the bark. Probably not so, but we do know that the bark of the cinchona tree contains quinine. And quinine is very effective against fevers, especially against fevers caused by malaria. Thomas Sydenham, English physician, who is often called sort of the English Hippocrates, although he came much, much later, because he made such important changes in the practice of medicine. Now, as I told you, laudanum had been previously introduced by Paracelsus, but he refined it. He came up with a specific formula, as you can see, 2 ounces of opium and a pint of strong red wine, a quart spiced with saffron, cloves, and cinnamon. So this really was concocted as a medicine, and it was reproducible. Whereas the laudanum that was suggested by Paracelsus didn't have any recipe attached to it. He made it up whichever way he thought was the best. But laudanum now became part of the pharmacopoeia, and this was important philosophically because Sydenham introduced the idea that purity of a drug was of importance. You had to know what you were taking, and you had to know how much you were taking. In North America, Dr. Benjamin Rush, who actually was one of the signers of the Declaration of Independence, so he was a highly thought of physician, and he was really the first one to warn about the detriments of alcohol, that this is something to which you could get habituated, and he knew that this wasn't a good thing. And he railed against the excessive consumption of alcohol. He was the first in history to do that. Up to that time, drinking alcohol was not frowned upon, and in fact, getting drunk was not condemned in any way. William Withering in 1785 made one of the most important discoveries in history of medicine. When he learned from, as the story goes, an old wife of Shropshire, who had been dispensing folk medicines, that brewing a tea from the foxglove plant was beneficial to treat heart problems. Congestive heart disease is when the heart doesn't pump properly and your blood doesn't circulate. A lot of the liquid leaks out from the blood. You get edema, you get swelling, etc., swelling in the ankles. Withering found that when you use the foxglove plant to treat this problem, the problem indeed would resolve. He wrote this up, as you can see, in account of the foxglove, and you see him holding the foxglove here. Foxglove contains a mixture of compounds that we collectively call digitalis. And digitalis was used from that moment on to now. Although today when someone suffers from congestive heart disease, they're not told to go and graze in a field of foxglove, because we know what is in there, and the active ingredient, digoxin, has actually been isolated, and that is what is used as a medicine today. But all of this was introduced 1785 by William Withering. And then one of the most momentous developments in the history of medicine in 1796, when Edward Jenner carried out his famous experiment with cowpox. Now, smallpox is a terrible disease, and it was responsible for millions of deaths every year at that time. What Jenner noted was that milkmaids who milked the cows didn't get smallpox. They did get another disease that came to be called cowpox, which was also characterized by these pustules on the body. And he wondered what was protecting them against smallpox. Decided to find out. So he took some pus from these pustules, injected it into a young boy, James Phipps, to see what would happen. Now, of course, no ethics committee today would ever allow something like that. Probably even his mother wasn't really told what was going on here. But anyway, he inoculated him with pus from a cowpox pustule, and then a couple of weeks later exposed him to matter from a smallpox sufferer. And he waited and waited, and the boy never got smallpox. And vaccination was born. The name vaccination was actually coined by Louis Pasteur, from vaca, the cow, because this was all started with cowpox. And even back then, at first, there was a lot of criticism about this. There were cartoons showing cows growing out of people's bodies. And of course, we've had opposition to vaccination ever since that time, even though it probably is the single most important intervention ever in medical history. Now, you wouldn't think that Napoleon had too much to do with development of drugs, but he sort of did. In 1800, he said hash was gonna be made illegal. He didn't want the Frenchmen, especially his soldiers, taking hash, and they had learned about that because of their exploits in Egypt in the Napoleonic Wars. And hash smoking was very popular in Egypt at that time. So he said, no more, we're not going to have this. So this was the first time that someone spoke up against the use of cannabis. In 1804, another important turning point, Friedrich Sertiner, a German chemist, was the first one to isolate morphine from opium. Up to that time, opium had always been used as a crude resin. But now he was able to isolate it as a white crystalline material, and he even tested it on 3 students. Again, to what extent they volunteered is questionable, but he tested them and he saw that they passed out when he gave them enough morphine. And he coined the name morphine from Morpheus, the Greek god of dreams, because it put people to sleep, sometimes permanently. And then, 1832, Pierre-Jean Robiquet looked at opium to see what else was in there. And he isolated codeine, which is an opiate, meaning it comes from opium. It is still the most widely used opiate in the world. It is an excellent painkiller. It is often combined with other painkillers, like with Tylenol, but it's a very, very effective painkiller. But it is also addictive. Not as addictive as morphine, but it is addictive. In 1832, Justus von Liebig, perhaps the best-known chemist of the 19th century, made the world's first synthetic drug. Now that's interesting. We're talking about 1832, not so long ago. This is the first time that anyone made a drug from scratch. Because remember, up to that time, what were we talking about? We're talking about alcohol, we're talking about opium, we're talking about mandrake and foxglove and all of these. These are all naturally occurring materials. He synthesized chloral hydrate. He didn't synthesize it thinking it would be a drug. He was just trying to see what chemical reactions would do. And he just happened to carry one out, which resulted in chloral hydrate. It was only after him that it was discovered that this was a good sleeping agent. Today it is sometimes referred to as the Mickey Finn, because it is believed to be the stuff that bartenders put into people's drink when they want to get them out of their hair. In 1842, William Shaughnessy, who had been a physician in India, came back with wonder stories about what cannabis could do. And he introduced this, and the Victorians were very appreciative. They were very much into the use of cannabis. It was very popular and very legal in Victorian England. And then in the late 1800s, we finally have the advent of what we call the patent medicine era. The story was that these things were patented and therefore they were safe and effective. This was nonsense. They weren't patented. There was no patenting process at that time. Anyone could sell anything that they wanted. Now this one, Mrs. Winslow Soothing Syrup, was one of the popular ones. It was supposed to calm down children, which it did because it contained opium. So of course that was a sleeping substance. So of course it did calm down the children. And after this, of course, we had all kinds of other nostrums that were being sold. All right, then we come to another epic moment in 1846, when William Morton demonstrated the use of ether as an anesthetic, Massachusetts General Hospital in Boston. Before this time, they carried out surgery, including amputations, without any anesthetic. Well, sometimes you use opium, but opium has a very narrow therapeutic window. The dose between putting you to sleep so that you can withstand surgery and dying is very small. Right? But ether was much, much better. It had the benefit that the patient would wake up after the operation, and it came to be used immediately. And then another pivotal moment with the introduction of the hypodermic syringe. At first, it was used for opiates, which was great because it could be injected into the part of the body where there was pain. The story is that he got the idea for a syringe after being stung by a bee. He felt the needle and he thought, well, maybe we can make use of this. And of course, we have been making use of this ever since. It's a relatively recent discovery. German chemist Albert Niemann finally isolated cocaine from coca leaves, which had all kinds of consequences. Cocaine was a local anesthetic, so it was useful for that. But of course, it also very quickly became abused. And it's much easier to abuse the powdered cocaine, which already has been extracted from leaf, than to chew the coca leaves. This was capitalized on. French chemist Angelo Mariani, who came up with Vin Mariani, popular French tonic wine. Yes, of course it was popular because it was made with coca leaves. It was made with cocaine. And as you can see, Pope Leo XIII, I guess popes in those days were into trying things. He liked it. He liked the Vin Mariani and therefore offered him a medal. Vin Mariani was around for decades. It's no longer with us, of course. It would not be legal to sell anything with cocaine. And incidentally, stories that Coca-Cola originally contained cocaine are not true. The original flavoring did contain some coca leaves, but they had already been stripped of cocaine. So it was only for flavoring. But cocaine did turn out to be a very effective local anesthetic, which was demonstrated in 1873 by Alexander Bennett. And you can see that they sold cocaine toothdrops. You drop the cocaine on your cheeks to take away any pain. Morphine had already been isolated by Sir Turner, as I told you, in 1804, but it was in 1874 that Wright took morphine, cooked it up with some acetic acid, that is vinegar, and converted it into heroin. The chemical name for heroin is diacetylmorphine. It was coined heroin because it was thought it was going to act in a heroic fashion, better than morphine. Turned out not to be the case. It was more addictive than morphine. Now we start coming to some of the drugs that are more recent that you will recognize. 1878, acetaminophen was introduced. In North America, we call it Tylenol. In Europe, they call it paracetamol. It's exactly the same thing. It's acetaminophen, prepared for the first time in 1878. Probably the most overhyped drug in the world. Even though it is so widely used, when you look at the scientific literature for efficacy, it is very poor. Much of Tylenol's benefits are due to the placebo effect and the constant advertising, the constant telling you that it works really well. That's not what the scientific studies show. It's not that it has zero pain relieving effect, but it isn't very effective, but it still is widely sold. In 1893, methamphetamine was synthesized. That's the stuff that Breaking Bad, the recent television show, was all about. That's what they were trying to synthesize, crystal meth, which of course is a substance of abuse, but it was first made as long ago as 1893 by a Japanese chemist. In 1897, Felix Hoffmann made aspirin. This was a simple reaction. He took salicin, which is found in the bark of the willow tree, naturally occurring compound, and he converted it into acetyl salicylic acid. As the story goes, his motivation was that his father suffered terribly from arthritis, and he was taking willow bark extract at that time, which was recommended. But willow bark extract does have salicin, which is the pain-killing chemical, but that also upsets the stomach. So he was trying to negate that side effect, and he cooked it up with acetic anhydride, made acetyl salicylic acid, which indeed was less irritating to the stomach, and it did relieve pain. And today it is the most widely sold drug in the world. A lot of profits to be had from aspirin. So as you know, later it turned out to have an anticoagulant effect, which can be used in people who have had a stroke to try to reduce the chance of second stroke, etc. It can be used to try to reduce the risk of a second heart attack. And now we're even learning that it may have a beneficial role in trying to prevent colon cancer. And then Emil Fischer, in 1903, came up with the first ever barbiturate. sedative, barbital, although it was given the trade name Veronal because he had been to Verona in Italy. He thought it was the sleepiest town he had ever seen, and they gave it the name Veronal. And barbiturates became very widely used and abused as sedatives. The story of Valley of the Dolls that you probably read at some time, that was all based on barbiturates. They're still around today as sedatives. In 1907, the first synthetic antimicrobial agent was introduced by Paul Ehrlich. This was salvarsan. Salvarsan, the name came from safe arsenic, because he had noted that on microscope slides, bacteria could absorb certain colors so that you could see them better. So he thought that if he could poison these staining materials, he could also poison bacteria because he knew that they absorb these things. And that's how he came up with salvarsan, which was effective in the treatment of syphilis, a very big problem in those days. Amphetamine, or oxycodone, was introduced in 1916 in Germany as a pain-killing substance. It was a derivative of morphine. So they were constantly looking at the molecular structure of morphine and trying to improve upon it, take away the addictive potential and improve the pain-killing effects, and they came up with oxycodone, which was very popular during the Second World War. In Germany, Hitler was addicted to oxycodone, and near the end of his life, which of course didn't come soon enough, he was addicted to a number of substances, including Eucodal. His physician, Theodore Morel, would inject him with this on a regular basis. Then we come to the most significant Canadian contribution to the history of drugs, and that, of course, was insulin. 1921, Banting and Best isolated insulin from the pancreas of a dog, and within a short time, it was used to treat diabetes in humans. Not cure it, you can't cure diabetes, but you can treat it. And it was all because they had experimented with dogs. And this is always something to point out when you hear all of the stories about how, animals are being abused in medical research. The fact is you cannot do medical research without animals because you can't use humans as guinea pigs. And therefore we have to resort to this. Although, as I told you, salvarsan was the first synthetic antimicrobial agent, the most famous one was introduced in 1928 when Alexander Fleming made an excellent discovery. He had been growing some bacteria in a petri dish to see what could stop their growth, and he went away for the weekend. And when he came back, a mold had drifted into his petri dish. Most people would look at it and say, hell, this moldy crap, I gotta start over again. But he took a careful look and he saw that bacteria around the mold had died. And he figured that this mold was producing something that was killing the bacteria. He was never able to isolate that. So he just made this observation. He never managed to bring that to fruition. That took another 10 years, as we'll see in a moment. And then in 1932, Gerhard Domag in Germany, notice that so much of this work at that time was done in Germany, right? This was the most advanced scientific country at the time. The greatest scientists, the greatest philosophers, the most educated public. That's the people that went astray with Hitler. This was not some third world country. This was the most advanced country in the world, which is difficult to understand. Anyway, he came up with sulfanilamide, which was effective against bacteria. They were, of course, constantly on search for substances that would kill bacteria, because Pasteur had already demonstrated, the germ theory of disease. The problem was that when sulfanilamide was sold in the US, it wasn't sold in a pill form. It was sold as a liquid, the elixir. And when it was concocted, they weren't careful with what solvent they used to dissolve it. The chemists who did that just tried different solvents in his lab, and he finally came up on diethylene glycol. He tasted it, it was sweet, and that's all it took. It went on the market. Turned out that diethylene glycol was poisonous, killed over 100 people. But this had a benefit in that it resulted in the passage in 1938 of the Food, Drug, and Cosmetic Act in response to this, and now companies had to prove that their medicine was safe before it was put on the market. Then in 1934, we saw the introduction of benzatrine, the first decongestant. It was used for common cold. It was also used for the treatment of asthma. And the active ingredient in it was amphetamine. Amphetamine is a synthetic substance. It does not occur in nature, and it is still widely abused today for several reasons. First, it can give you a high and also curbs the appetite. And at one time, amphetamine was actually prescribed as an appetite suppressant. In 1935, Edward Kendall and Philip Hench managed to isolate cortisol. They extracted it from the adrenal glands, and of course, very quickly we found that it had all kinds of benefits because it is such a powerful anti-inflammatory substance. And it is used for numerous conditions today. And then Albert Hofmann in 1938 synthesized lysergic acid diethylamide from lysergic acid, the stuff that was extracted from plants or from a fungus called the ergo fungus that grows on plants. And he inadvertently touched his lips with his hands, which had not been washed. And he had the first ever psychedelic experience on LSD. It took a bit of time until it kicked in. He was on his bicycle going home, and that's when he had the first hallucinogenic effect. And every year, this is celebrated by Bicycle Day, when they think back to the exploits of Albert Hofmann. Now, I told you that Fleming never isolated penicillin from his mold. It took another 10 years. And it was Chain and Florey, two a German and a British scientist who managed to isolate it. The three of them together shared the Nobel Prize, even though they never worked together. But Fleming, of course, had the original idea, and they would have never done what they did if Fleming hadn't made his discovery. In 1941, Albert Alexander, a policeman, scratched his face with a thorn from a rose, and it became infected. And he was in a very serious situation. They gave him penicillin. He was the first patient ever on whom penicillin was tried. He got better. But they didn't have enough penicillin. It was very difficult to isolate that time. So they isolated it back from his urine, and they gave it to him again, and he got better. And they went through this a few times until they ran out of penicillin and he died. But that was the first time that penicillin was used. And then, of course, it just changed the course of history. Those of you who suffer from allergies, well, in 1946, an answer came, and that was the first effective antihistamine, diphenhydramine, which is still around today as Benadryl. Very effective. The downside of it is that it makes you drowsy. However, that can also be put to its benefit because it's the active ingredient in NyQuil. So here's the side effect of a drug that also proved to be useful. But when you're taking it for allergy, of course, you read the box and they tell you don't operate heavy machinery. Well, your car is a piece of heavy machinery. So when you take these antihistamines, you have to be very careful with driving. One of the most common drugs still prescribed today is thyroxine, which is the hormone that the thyroid gland produces. And if it doesn't produce enough, you suffer from hypothyroidism, which ceased to be a problem in 1949 when thyroxine was made in the lab, synthesized in the lab, and introduced as a drug. Now, thyroid problems were treated even before that, but they were treated by taking animal thyroid glands and extracting them for the hormone. and you needed a lot of peak thyroid glands to have enough hormone to treat a patient. When it was made synthetically, all of that changed. Then, in 1951, the first antipsychotic drug. Before this time, mentally ill people ended up in insane asylums, often being tortured, they were tied down, they were subjected to terrible treatments, in 1951, chlorpromazine was introduced, and it basically emptied the psychic wards of hospitals where patients had been locked up. Treatment with chlorpromazine calmed them right down. They stopped hearing voices. Very effective drug, still used today. One of the problems with blood is that it can coagulate. And when it coagulates and forms blood clots, that can cause a heart attack, it can cause a stroke. But in 1954, a drug was introduced that prevented coagulation, and that was warfarin. It was discovered in a very interesting way. It was found that cows that were eating moldy hay bled. It had an anticoagulant effect. Out of that observation came warfarin, but at first it was difficult to get people to use it because it was also used as a mouse or rat poison. For the same reason, they will bleed to death if they consume it. But just because you can kill a rat with warfarin doesn't mean that you can't keep a human alive with it. So the same chemical can be used for benefit or for detriment. 1955, the introduction of polio vaccine. And of course, polio was a horrific disease. People ended up in iron lungs with polio, but Jonas Salk came up with the vaccine, and it worked. And of course, it changed the course of history. Another drug that had a huge impact was thalidomide. Introduced in 1956, this was supposed to ease morning sickness in pregnant women. And it had been tested. It had even been tested in monkeys, but it was not tested at the right time. It was not tested in the first trimester of the pregnancy, which is when the damage can take place. And of course, we know the damage, children who were born without limbs. About 10,000 such children were born, mostly in Europe, because it was never put on the market in North America. Thanks to a McGill graduate, Dr. Frances Kelsey, who investigated this, and at that time she was working for the FDA and would not allow it to go on the market. We would have had thousands and thousands of people here born like that if it would have put on the market. High blood pressure has been the bane of existence for many people, but in 1958, the problem really stopped being so big with the introduction of diuretics, specifically chlorothiazide. Diuretics work by basically making you pee more, so you lose some of your blood volume, and therefore there's less pressure. It has saved countless lives, and of course, eventually it was followed by many other antihypertensive drugs, but this was the prototype. In 1961, a huge impact was made by the introduction of the birth control. It was highly controversial, of course. It still is today, right? But it was very effective, and it changed the morals of society. Not that long ago, 1961. One of the most widely used drugs today is Advil, and that came only in 1961 at the Boots Company in England. This is what we call a non-steroidal anti-inflammatory drug. Non-steroidal means not like cortisone, and it works very well. It can also be combined with codeine to be even more effective. In 1966, David Jack, once again in Scotland this time, a Scottish physician, discovered salbutamol. This was a bronchodilator. It works very similar to ephedrine, which to the plant I told you was used thousands of years ago. And today we use this as Ventolin. It is a so-called rescue inhaler. You inhale it when you have an asthmatic attack, and it opens up the bronchi and allows you to breathe. The first anesthetic, as I told you, was introduced in 1846. That was ether. But there have been others introduced since that time, including propofol. And of course, we first heard about that, at least the public first heard about it when it was one of the drugs that caused the death of Michael Jackson, probably the drug, because he was injecting it to go to sleep, because it is an anesthetic. It is very widely used. Every emergency room has propofol. They use it for minor surgeries. It really is an excellent drug when it is properly used. How many of you are on statins? There you go. Well, this only goes back to 1987, not so long ago, when it was discovered that an extract of the Aspergillus terreus fungus had a compound in it that would prevent the body from making cholesterol. So this was the first anti-cholesterol medication, the first statin drug. If you're suffering from heartburn or esophageal reflux, you probably are taking a proton pump inhibitor, either as omeprazole or Nexium or Prilosec. All of those basically are the same thing. They prevent the stomach from producing too much acid. So when it comes up into your esophagus, it isn't so painful. There are, of course, downsides with PPIs, as there are with every medication. But used properly, it is very effective. Paclitaxel, widely used anti-cancer drug, was isolated from the bark of the Pacific yew tree. And again, there was controversy about that, because it requires killing the tree to take off the bark. And the tree huggers, of course, are very much against that. You know, didn't matter that cancer patients were dying, you got to save the trees. Right? Well, anyway, today there are simpler ways to make it. It can make synthetically, or they found other plants that also produce it. But it is a very effective anti-cancer agent that really nature gave us the clue about. 1995, finally, something could be done about AIDS, terrible disease in which the immune system is destroyed so that the body just can't fight off any invaders. And saquinavir was the first protease inhibitor, and of course it has been joined by many others. And that is the case for many of the drugs that I've talked about. These are the prototypes, but eventually, they were joined by others in the family, sometimes improvements. When it comes to antihypertension, we have dozens of drugs besides just the diuretics today. In 1996, Purdue Pharma introduced OxyContin, which is a time-release formula of oxycodone that had been developed by the Germans. A very effective painkiller, but it was highly addictive, and the company never admitted that. And today we have an opioid crisis, as you know, and OxyContin is responsible for part of that, because it is so easy to become addicted to it. And they were prescribing it for things like wisdom teeth removal, which should never be done. The disease that so many people are concerned about today, because it's an age-related disease and we're all getting older, is Alzheimer's. 1996, the first drug ever in an attempt to treat Alzheimer's was introduced, and that was Aricept. It is not very good. There are no good drugs for Alzheimer's. But what it is supposed to do is increase a neurotransmitter called acetylcholine. Neurotransmitters convey message between nerve cells. In Alzheimer's disease, there's not enough acetylcholine. This drug will increase acetylcholine, but the results really are not very good. One of the most profit-earning drugs ever introduced is Viagra in 1998. Now, interestingly enough, it was not at first introduced for that reason. It was a treatment for angina. But then they heard from men that it had this side effect. And I told you, not all side effects are bad, right? So they capitalized on that, and this, of course, has made Pfizer an absolute fortune. The first monoclonal antibody, and this is a totally new class of drugs, was introduced in 2004, and anything that ends in mAb, you'll recognize as a monoclonal antibody. These are the so-called biologicals. They're derived from living systems. Usually there's a lot of technology involved in producing it. And these are effective. We've used them to treat COVID patients. They can be used to treat arthritis. They can be used to treat cancer. There's some hope that one of these monoclonals will be effective in the treatment of Alzheimer's disease, but that's somewhat down the line. In 2005, we introduced what perhaps right now is the most profitable on the market, and that is Ozempic, but the original GLP-1 agonist, that is a drug that curbs the appetite, was Byetta, introduced in 2005. And it worked very well for type 2 diabetes. That's why it was introduced. But the side effect that they noted was weight loss. But Byetta was never sold for weight loss. It was only sold as a type of diabetes drug. However, when the obesity epidemic hit, and is still hitting, the side effect of that drug became the most marketable, and that's why we now have Ozempic. Although Ozempic 2 was originally only a type 2 diabetes drug, but once it's approved, the doctor can prescribe it off-label, right? But now we have another one called Wegovy, which is just a higher concentration. It's exactly the same ingredient as Ozempic. And that's where we stand today. So that was a very quick tour of history, but you get an idea of how these things developed and when they developed, and how sometimes it's accidental, sometimes it's targeted research, you never know where it's going to come from. But now we have these literally thousands of drugs that are available to us now. And I suspect that the vast majority of you are taking one or more of the drugs that we have described here. So now at least you can put it into a little bit of context, you know where they come from. All right, any drug that I left out that you're taking that you want to know about? Yeah. Yeah, what do you want to know? What are you're taking it? Yeah. Prolia will strengthen bones. Okay, there's no question about that. It has downsides. It can have an effect on the jawbone, which is not desirable. And I think it probably is overprescribed. If you have a diet that has enough calcium in it and has enough vitamin D in it, you probably don't need it. Now, the thing with drugs like Prolia is that you look at x-rays and it shows that the bone is stronger, right? However, when you look at the research, it also shows that it doesn't prevent fractures. And that's the end point that you really want to look for, right? Is it going to prevent fractures? Not whether or not it shows some improvement on an x-ray. So I think it's not a great drug. Yeah. Yes, surprisingly, it's not all that difficult. You add ammonia to a solution of opium in water. It's white soluble water. You add ammonia, it precipitates out the morphine, and then you just add some acid to neutralize it, and it comes out as a crystal material. So it can be done exactly the same way that Sir Turner did it back in 1804. They do that. They do that. Morphine can be synthesized chemically, but it's too expensive to do that. So it is, in fact, harvested from poppies. And, you know, there are legal fields of poppies in Bangladesh and India. There used to be in Afghanistan too. I don't know if they still have legal ones. They have a lot of illegal ones there. But yeah, it still get it from poppy. And it's the same poppy, the seeds of which you see on your bagel. And I mean, I'm sure you remember the Seinfeld episode when Elaine ate I don't think it wasn't a bagel, like it was a muffin, right? The poppy seed muffin, and had opium in the urine, yeah. Because now these tests and the urine tests are very sensitive. They can pick up very small amounts of material. Yeah. I would say that the benefits of consuming coffee, as we now know, greatly outweigh the detriments. We have all kinds of evidence that 2 to 4 cups of coffee a day are good. All kinds of things. Reduce the risk of Parkinson's disease. Coffee is probably the greatest source of antioxidants in the North American diet. So I would say that, you know, unless you have a personal reaction, some people get palpitations from coffee. Some people get agitated. Then, of course, you stay away. But if you enjoy coffee, there's no reason not to drink up to 4 cups a day. Yeah. 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 Well, Advil is better. Yeah, I mean, there's, you know, it's pluses and minuses. Yeah. I mean, if you get terrible irritation of the stomach with an NSAID, then of course you can't use it. But most people don't. You know, I mean, most people have no problem with using ibuprofen. Can you mix? Yes. In fact, I think there's a commercial version of that available. Yeah. Fosamax, same as I told you, is you see the benefits when you look at X-rays. You see the improvement in the bones, but you don't see the evidence of reduced frequency of fractures. Those drugs are very good for whoever sells those drugs. Yeah. Ribelsis is just an oral version of Ozempic. Okay, it's a pill form, because Ozempic you have to inject once a week. Ribelsis you can take, but Ribelsis is only for type 2 diabetes. It will not cause weight loss. You can't, the dose that you need to cause weight loss, you can't take orally. It has to be injected. Curare, good point. Of course, curare should be in there for several reasons. One is because it was the prototype of muscle relaxant, and the other, of course, is that it was discovered here in Montreal at the old Queen Elizabeth Hospital. Curare comes from a plant, South American plant, and it's a muscle relaxant. And up to the 1940s, when it was discovered here, surgeons always had a problem, because when you cut into someone, the muscles go into spasm. And curare stopped that. Absolutely right. Curare definitely should be in there. It will be next time. Yeah. Yes. Right. This is about the potential causes of Alzheimer's disease. And the current opinion is that it is due to the deposit of 2 kinds of protein in the brain, amyloid and tau proteins. which basically gum up the transmission. They don't allow acetylcholine to do its job. That's the theory. However, the sort of the fly in that theory is that there are lots of people who have amyloid deposits in their brain, which can be shown by brain imaging, who don't have Alzheimer's disease. And a lot of people with Alzheimer's disease who don't have any of these amyloid deposits. So it is controversial. It's controversial, and there are people who say that this isn't really the right approach. But that's where it stands. But right now, there's a lot of interest in a new monoclonal antibody, which was designed to chew up the beta amyloid. And the preliminary results are not spectacular, but at least they do show something. They do show some improvement or at least slowing down the memory loss. So I don't know, it's probably a combination of different things. It's that just having the amyloid deposits is probably not enough to trigger Alzheimer's. There's some other cofactor there. Right. Yeah. I mean, there are now dozens of antihistamines but all of the drugs I talked about are the ones that were first introduced. They have essentially all been improved upon since that time. Yes. Yes, SSRIs, Prozac, of course, was the prototype that could have been in there. They're not being looked on with great favor these days. SSRIs are sort of the miracle drugs where the miracle has evaporated. Yeah. Yes. Yeah. Yeah. They all have side effects, but SSRIs have not delivered what they were supposed to have delivered. Yeah. Metformin? Yeah, I mean, metformin is an oral anti-diabetic drug. Certainly, I guess, it would deserve to be in there if we had more time. But there are, a lot of drugs that could be in there. Yeah. Yes, well, I mean, metformin now is supposed to do much more than just prevent type 2 diabetes. It's supposed to be the anti-aging drug. I know some doctors are taking it with that belief. I don't buy into that, but it's very effective for type 2 diabetes. No. Yeah. Every pharmaceutical company has a division of natural products where they search plants of all kinds, flowers but it's a very difficult thing but take coffee as the example, which comes from a plant, right? You know how many compounds there are in that cup of coffee you're drinking? Over 1,000. Okay? So that's the thing with all plants. They're mixtures, very complex mixtures. And it's a very difficult thing just to separate them into their components if you're going to test those individual components. But it is absolutely being done. And that Taxol that I told you, the anti-cancer drug, was a direct result of a systematic search for substances. All right, see you in October.